Welcome to Therapy Cable. I'm Dr. Ehsan Gharadjedaghi, clinical psychologist. Today we will be talking about the different types of treatment for depression. And so let's start with kind of, first of all, differentiating uh, what depression really is, and then we can get into the treatments because it's an important distinction that we want to make, at least I would like to make for people to realize that sometimes depression is literally just kind of outside of our control. And that's important. Let me share with you, in generally in the field of psychology and especially what is regarded as cognitive behavioral therapy. There's a tendency to think that, well, depression basically is a mood disorder, if you will, or state of our feelings and mood that can easily be overcome by changing our thoughts. In most cases, perhaps, yes. But then there are some cases that we see, what we see as a refractory or a kind of a resistant type of depression. So no matter what kind of a cognitive modification treatment you engage in, you notice that the person who is depressed and clinically depressed cannot get out of it. So the question is why? How come that the treatment that is supposed to work and does work most of the time fails in some situations? And that's why I make this distinction, because we also know from neurological research and neurobiological research that depression also literally affects the brain chemistry. So depending on the intensity, duration, impact that someone has endured being depressed over many years, their brain chemistry may have literally changed. And with that, what do we mean? Basically, specifically the neurotransmitters, neural pathways, the cellular structure of our brain cells have been modified over time. Therefore, there is a limit to how much our thought modification and belief modification can actually impact that cellular structure or that brain chemistry. And you see that in a lot of cases where a client and a person may literally attest to you that yes, they know that perhaps they're over exaggerating, kind of have a very negative and grim outlook on life, and they know it is not necessarily founded in good facts and realistic evidence, and yet they cannot help themselves simply being depressed and kind of being under this pressure, this burden of negativity, and they literally cannot help themselves. They know better, but they can't. There's a distinction between knowledge and skills and ability, and that particularly speaks to the intense impact that neurochemistry has on a person's brain, meaning that they're literally paralyzed, and we can't just expect them to walk their way out of their paralysis, to pull themselves out of their paralysis. So having said that, what I would like to do is, first of all, talk about the non-resistant, non-refractory, the more regular types of depression that are amenable to most treatments. And then certainly, then we will get into how to deal with treatment-resistant depression. As such, let's start with kind of very quickly understanding what we're talking about in terms of depression. Depression literally is a state of being, I would say, because it encompasses multiple functions of a person that literally debilitates. A person feels, thinks, and behaves in a very limited fashion, unusual, uncharacteristic to what they used to or what they're capable of. Now, specifically, we can look at really, I would say, 4 regions from a biopsychosocial, spiritual perspective, if you will. What we can look at it is, how does depression, a state of being so debilitated and almost paralyzed, and let's say, down, affect a person's presentation. So or processes. So on the one hand, when we look at those processes, so cognitive, intellectual abilities, decision-making, insight, judgment, all of those are impacted to the point that a person makes the wrong decisions, they don't pay attention, cannot focus or concentrate. They have really very shallow insight into things. They don't even spend much time, thinking and analyzing and, really dissecting stuff, because they just are not in the mood for that. They jump to conclusions quickly, want to get over the issue and problem. They have low, patience for things. That's kind of the cognitive, intellectual impact that we see people who have depression. On the other hand, the emotional aspect is that they literally report being down, being tired, fatigued, frustrated. They just they're not in the mood to do things or get excited about things. So the level of excitement is very low. They don't experience joy and happiness. They report that they're just kind of sad and, in fact, more than that, also hopeless and literally helpless in certain situations. And then in terms of their actions that they may take, they're not into taking any actions. They rather not take any actions. They're kind of in a certain state of inertia, don't want to do things, don't want to engage in anything. They just kind of want to be left alone. And part of that also leads to seeking isolation, staying away from other people and just kind of, collapsing within. And again, part of, I would say, behavioral aspect, what we also see is the psychomotor retardation, meaning the slow characteristic of motion and mobility and activation that they have. Everything is more on a slow pace with them. That includes the rate of speech, walking, talking, moving their body parts, just kind of the mobility that can be observed that they're willing to engage in. Certainly, sleep hygiene and diet can be affected to a point that people either cannot sleep or just sleep too much, or they either don't eat at all, they have no appetite, or they tend to overeat a lot when they're depressed. There's a distinction called, kind of regular versus or typical depression versus atypical depression that I really don't want to get into right now because we want to get to the treatment part. But as a basis, what I explained to you really covers those biopsychosocial. The spiritual aspect is more of also a depressed state of mind where a person would not be willing to entertain a more, kind of spiritual, even religious, a more supernatural type of meaningfulness or relationship to a higher power and the purpose and meaning of life, and kind of trying to make sense out of what is happening in their situation. They rather not engage in that. A lot of times they lose their belief in a higher power or divinity or spiritual understanding of the world. So literally all of that culminates into a person getting to a point that the pain that they're experiencing becomes unbearable, and then that it can become very, very dangerous to a point that a person may, the kind of resort to self-harm, self-injuries, and or suicide. Having said that, when we are talking about treatment, we want to relate what treatment modalities do to these areas of function. So, in other words, how do we know that treatment works? Know what treatment we will be talking about. The way we know is that we would look at the improvement of a person's in all these areas of function. So let's say they went through, like I mentioned, cognitive behavioral therapy for depression. So ultimately, what we would be looking at is, have they improved in their decision making, in their insight, in the, kind of the judgments that they are making on a day-to-day basis, the way they look at things and reason about them. How do they report their improvements in their feelings? Is that changing? Are they shifting from this kind of apathetic type of a mood to more of a joyful, kind of a happy, peaceful type of a nature? Are they developing hope? Are they also looking at some abilities that they have? Kind of are they shifting from inadequacy to adequacy, to capability, ability, a sense of self-confidence, if you will. Certainly, are their behaviors changing, in the way they talk, engage and interact with people? Are they making improvements in terms of the mobility and, the pace of speech or walking or talking or engaging in any type of a, probably bodily activity that they maybe even playing sport, going for a run, being more excited in their body, in their behavior. Are they also developing some sense of meaningfulness, perhaps, about life, purpose, and kind of goal setting? Are they looking forward to something in the future? So when those improvements are discernible, then we know, okay, the treatment is working. Now, the other thing what we want to do is literally distinguish between different types of treatment modalities in terms of, which kind of the effectiveness of each modality as it relates to perhaps some of these functions and or a certain population, such as, some like younger folks may be amenable to a certain modality versus older individuals, men versus women, and also culturally, certain, let's say, ethnicities or groups that are, let's say, more prone and willing to engage in, let's say, talk therapy versus some kind of a, let's say, therapies that focus more on emotions and feelings, or are more experiential in nature, or even include some kind of a, let's say, body therapy, such as yoga, meditation, acupuncture, massage, Reiki, and or again, like I mentioned, the experiential therapies, is simply getting the body into some kind of action, such as, when we talk about going for a walk or becoming physiologically more active in life, that is an example of more of an experiential treatment. So now let's get into these different modalities for depression or treatment for depression. Generally, traditionally, there is, when you look at the history of psychology and psychotherapy, you find that, one of the forerunners of psychotherapeutic treatment has been regarded as the psychoanalytic, psychodynamic type of branch of psychology. So that's more the branch that focuses on helping a person look at depression as a symptom for a kind of unresolved conflict that happens subconsciously or unconsciously within the psyche of a person. So someone who would engage in psychodynamic, psychoanalytic therapies to deal with depression, they would really dig deep into the history of upbringing, the developmental history of a person, and their psyche, and certain conflicts that may exist that are in the subconscious, that the person is not even aware of. That may very well have to do with, early, I would say, childhood trauma, or even if it is not trauma, some certain conflicts that may have existed, for which the mind has created some coping mechanisms to kind of, or defense mechanisms to kind of, put them aside and get over them. But as a result, this symptomatology has led to development of some depression, that is depressive style that we talked about, and the person is not really capable of kind of putting the finger on the root cause because it's in the subconscious. So Psychodynamic theories a lot of times help with that, and we don't have really time to delve into all the details of how the treatment works, but that's literally good for, I would say, very much individuals who would report that they have no clue why they're depressed. Like everything is okay in their life, but they're still depressed. That's a good indication where you would use psychodynamic therapies, and that certainly requires a great ability of developing insight into the history and modality and the dynamics of a person's psyche. So people who generally maybe developmentally, intellectually, emotionally don't have this ability of even developing insights, or if they're not intellectual enough, they may really not benefit from psychodynamic principles. And some individuals may not even be open and amenable to actually digging deep into their childhood, into their upbringing, into the family dynamics and so forth. That's generally one approach. Now, within the psychodynamic branch, there are also sub-branches that then different individuals actually would like to engage in. There's Jungian psychotherapy that very much works with a lot of symbolism and meanings and a sense of collective consciousness or unconscious that can be regarded as more of a social construct on top of just an individual self. A lot of archetypes and persona that can be used in helping an individual kind of understand why all these symptoms of depression even exist in this person. There is another sub-branch in terms of self-psychology, in terms of how a person has come to believe who they are and develop their self-esteem and self-confidence, and therefore as they have been struggling with the sense of adequacy versus inadequacy, then they have ended up with this symptom of depression, and then how to deal with that and kind of change that dynamic from a low self-esteem and so low self-confidence to a higher sense of worth and value, and kind of kick out of that depression. There's object relations that deals with more or less representational memories of the world around us within the psyche, and then how these objects interact with each other. Further goes into what we call this intersubjectivity theory that helps with more or less all the details of how a person literally represents the outer world inside within them, and as such may experience conflicts, and then how to resolve those, and especially as it relates to interactions that take place between a person and other people in a social environment that may lead to more or less depression, if you will. We can look at those and kind of dissect that and help the person. And then also there's something called Adlerian therapy, which focuses more, I would say, it's very comprehensive and kind of integrative, uses multiple aspects of psychotherapeutic modalities, but specifically it very much helps a person ultimately understand that their life may have taken place, or these conflicts that they have had in the past may have taken place based on certain choice and decision they have made in the past, which was maybe half-baked and not fully understood. And today, as an adult and as a person who has more choices, options, abilities to do better decision making, that they can change those decisions and change those choices that they're making in life, therefore literally change their future. So that's kind of, I would say, the branch of psychodynamic theories and therapies that are out there that would help a person. And it really depends on the individual who is responding well to these types of concepts, and if they're excited about it, then they can dig deeper into their own life and psyche and kind of pull themselves out of this with the help of a therapist. Now, the other treatment that literally is a different branch of psychotherapy. It falls under what we call behavioral psychology or behaviorism. And behaviorism talks less about, actually nothing really about how we think, if you will, about certain stuff and how we analyze things or develop insight to things. But it focuses more on how people kind of, act, behave, engage in certain steps, the literal, tangible, pragmatic, practical actions in their lives. And it's very much based on more of a what we call reward punishment mechanism and schedule. So ultimately, it's more of an approach where we try to do what they call fake it until you make it. So you basically engage in certain activities and actions in the hopes of this engagement down the road translating to change of intellectual abilities, insight, better decisions, and better mood. So to give an example, if you want to contrast these two, a person coming in, say, reporting depression, from a psychodynamic perspective, you may say, okay, well, let's analyze and think about what keeps you from, let's say, going to the gym and working out, and then you think about those decisions that kind of predate, that come before actually going to the gym and working out. And ultimately, hopefully, that's the idea, to overcome those obstacles, and then the person really kind of developing that insight that there's an aha moment, and they say, oh, okay, now I know why I have been kind of postponing this workout, so it's all clear, then we go work out. Versus, and the behavioral perspective would not even get into the whys and how and those obstacles. The instruction would be, you got to force yourself to go to workout. You just get up in the morning, you just go work out. You don't think about it, you don't analyze it, you don't worry about it. It's more of a, relying on a discipline to get yourself to the action as quickly as possible. Now, once that happens and you go to work out a few times, as a result of that engagement and taking action, you will notice down the road the thoughts and feelings and doubts and all the almost like paralyzing analysis that have gone before going to work out, they kind of disappear. So that would be a good contrasting example to show how behavioral approach would work. And then it has its method and reasoning behind it. If you want to know why it works, is because the actual action of going to work out and literally engaging a person's body and physique will lead into real tangible chemical changes in our body. Basically, hormones and neurotransmitters start doing their magic, and we literally start feeling differently. And then as a result, also, we develop a little bit of a different perspective about life. So what used to be heavily debilitating and, kind of pulling us back and kind of burdensome becomes manageable or even literally unimportant. And we can just kind of ignore the obstacle and focus more on the solution. In fact, you could call it more of a solution-oriented approach. The other aspect I would say, which we began with, is that cognitive behavioral. So the cognitive behavioral literally is more of an extension between those two original theories that I mentioned, the psychodynamic, if you will, and then the behavioral. So cognitive behavioral kind of marries these two, focuses on both the analysis of how we think about life, how we analyze and go about, make sense and meaning of our actions, and kind of looking at the root causes of them, but also focuses on how we behave at the same time. So it kind of links them together. There's a myriad of tools that are being used. Again, we don't really have time to go into that, but there's specifically, I would say very briefly, they tap into certain what we call core beliefs, conditional beliefs, thoughts, and automatic thoughts that people have that encompass how they therefore end up feeling in a certain way and then taking actions. And the association between these three realms of functioning is highlighted. A person helps with, the therapist helps with using these tools and illuminates more or less how a person can change some of these aspects. Sometimes it's more like focusing on understanding the linkage between their thoughts and feelings, and sometimes it's between the feelings and the actions that they take. But understanding more or less this engine that is working according to that cognitive behavioral model would ultimately lead to a person being able to make different decisions in their lives. Kind of becoming more aware of the way they kind of act and react in a certain situation. And therefore, by, changing kind of almost microscopically or gradually some of these aspects of actions, reflections, reactions in the situation, understanding the way they're linked to each other, they can actually start making changes in their lives, and as a result become more confident, more empowered that things are under their control, and they can actually effectuate change and improvement in their lives and feel happy about it. There's another aspect which is comes from what we call a humanistic branch of psychology, and it kind of branches out into two subsections. One is literally what we call a person-centered, a client-centered type of a Rogerian type of idea, that depression is regarded really as a symptom of what we call incongruence between in a person's ultimate development of self-actualization, of finding who they are and making the most of their lives. They are either aligned internally and externally, or they are misaligned, meaning that their inner experience that they have doesn't really match what they're presenting outside. So there's that, kind of gap between two different experiences that they have to maintain, and as such, they have a true self and a false self, and this discrepancy is eating at them and creates that sense of depression. It could be some other things, symptoms as well. It doesn't always have to be depression. It could be anxiety, panic, whatnot, even psychotic behavior. But we are talking about depression. So humanistic approach, a Rogerian person, really helps a person to kind of close that gap. They help a person by providing unconditional positive regard in therapy. They help a person really develop more authenticity, where they are letting go of that false self that they have developed over time, and kind of bring out more of the true self, who they are, and assert their own sense of being and who they internally are into the world out there. And as you can imagine, that requires really a lot more validation and acceptance from the world outside, and that's initially provided by the therapist, but then also a person learns how to elicit that from their environment over time, once they have really experienced the probability of it, the feasibility of it, the reality of it, that it is actually possible. Now, the other sub-branch of the humanistic existential is the existential therapies that help. So what existentialism and existential therapies do, they understand that a person may have developed depression more again as a symptom of nihilism. Many times, having experienced some trauma in life may lead some individuals to end up in this meaninglessness in life. That as a result, and therefore they just end up, in despair and just give up and say, okay, well, life is bad, life is awful, and I'm depressed. And then they just don't want to do anything. They don't want to even exist. It's an it's apathy toward life. It is resistance to the excitement of the joyfulness of being alive. So how do we go about that? Really, the antidote is to help a person kind of make sense and meaning. Why do we exist? Why are we here? Is there a purpose to life? And if there is seemingly no purpose, perhaps there is something that they haven't looked at that they could actually discover as meaningful and purposeful. And that by itself, again, really, I would say, depends on the type of personality of an individual who is seeking that type of treatment. All these modalities that we have talked about are really dependent on the unique characteristics and personality of the person who is depressed. Some match that unique characteristics, some don't match. So the person really needs to seek multiple modalities until they have found the right approach. Part of what we talked about earlier, CBT, can also expand into sub-branches. There's something called DBT, dialectical behavioral therapy, which deals with more or less, I would say, experiential aspects of, again, I would say like a cross section between behaviorism and experiential and cognitive modalities, where a person is really literally taught how to manage depression, kind of refocus themselves, distract themselves, manage their depressive symptoms, instill and infuse some practices on a daily basis that they can redirect them internally from kind of engaging in some kind of depressed state of just being in this world, with more active, more engaging, more constructive type of experiences. Usually DBT takes about 4 months and has good results for depression as well. The other sub-branch again is CBT is called EFT, emotion focused therapy. It kind of really may sound paradoxical that it's part of cognitive behavior, because what do emotions have with thinking and cognition? There's a whole debate of what we call a Cartesian dualism about this, but we're not going to get into this. Emotions, you could think of emotions as certainly an important ingredient of being depressed. We have talked about that. And a lot of practitioners may just focus on that. They help a person really develop a better skill set in terms of their own self-regulation, emotional regulation around situations that make them depressed, or learning how to manage and control and direct their feelings and emotions to get themselves out of a depressed state of mind and more of an active, joyful, happy type of an interaction with their environment. So for some people, and especially in folks who are amenable to experiencing feelings, emotions, dissecting, analyzing emotions, that could be a great modality to take on. There are certainly what we call a systemic approach toward dealing with depression, but that systemic approach is, without getting too much into it, really relies heavily on basically relationships, specifically, family relationships, family dynamics, meaning someone who engages in systemic therapy, they wouldn't just work with that individual who is depressed. They would invite friends, family members, acquaintances, and really help a person change their relationships in order to feel better. And because then again, depression is regarded as a symptom of dysfunction in those relationships, specifically with close family members. That is certainly another modality that can be used, especially with, let's say, couples. We can know that couple therapy also could be very helpful, because at times, couples who feel depressed, that may very much be the symptom of that dysfunction in their relationship, in their coupledom. So when we attend to that, we change the system, it ultimately would lead to a sense of happiness and joyfulness rather than being depressed. Now, what I would like to do also address some, let's say, pharmaceutical, medical aspects, as well as, what we call the neurobiological aspects of treatment of depression. Certainly with pharmaceutical aspects, we are talking about medication that would be helpful. There's a whole category of what we call antidepressant psychotropic medication. And you would want to consult with a psychiatrist or a medical doctor to really get the details on this, especially a psychiatrist who's trained in both, let's say medicine as well as psychology. They can help a person kind of come up with a good set, I would say cocktail, if you will, at times 2 or 3 different compatible types of drugs, medication, that antidepressant medication, or what they call new generation medication, where some of these meds are both antidepressant as well as anti-anxiety, and really help a person from inside out, without necessity to change thinking or behaviors or emotions or spirituality. It's more of just a neurochemical chemical approach, where medicine, taking some medicine, they directly, by their function of pharmacokinetic type of a impact on the body, they can literally change the behaviors of cells in the brain and the body, including specifically what is called neurotransmitter receptors. These receptors are, without getting too much into it, they're part and parcel of how we literally absorb, perceive, process, interpret, and kind of engage with the more non-organic material of our mind and psyche, such as when we say thoughts, emotions, feelings, actions that take place. They're all kind of interrelated and really processed in the central processing unit that we call the brain, and the organic components interact with the inorganic components. And the pharmaceutical approach attends to the organic foundation and helps a person literally change that foundation by means of chemical modification. So at times, let's say taking antidepressants could help a person create what we call a floor or a ceiling, where internally they are chemically prevented from let's say falling into this abyss that a lot of people who have clinical depression do feel. They can't stop themselves from falling into that, let's say, suicidality. But when people do take antidepressants, they make internally, without their knowledge or intention, they have created this almost a safety net internally that would keep them from becoming highly suicidal. And then on top of that, certainly if you throw in the the non-pharmaceutical therapy, so the combination between pharmaceutical and non-pharmaceutical therapy can literally accelerate the improvement in a person with depression. As I mentioned earlier, the neurological, neuropsychological aspects or treatments that are also available out there. One of them is called TMS, or transcranial magnetic stimulation, and that is utilizing MRI technology to really almost like reorganize and kind of mobilize, if you will, some cells in the brain regions by putting them under magnetic stimulation. And again, that's helpful for individuals who have literally sought therapy in the past, but they have had almost little to no results, and they really need something outside of their intention and willingness and exertion of discipline, something more organic to help them. And this is not chemical, it's magnetic in nature, the TMS, but still through this mobilization or reorganization of those transmitter neuropathways, neurotransmitters, neuroreceptors, it does have some impact where a person may literally walk away from a series of these treatments with just a different state internally, and report that, yeah, they're not, as depressed or hopeless as in the past, or they don't feel as overwhelmed, as burdened as they used to. So that again can give a person almost a boost And I am a big proponent of combination of these principles to help an individual to kind of get over their depressive state of mind. I'm sure there are a few things that I've forgotten and haven't addressed. We will definitely invite your comments. We believe that I have missed out on any of the treatments that may or may not be, presently available, to be outdated, or there may be some very, cutting edge technology that is coming out that I'm not aware of. I welcome comments so I can address those and create more content in the future. And if you'd like to learn more about therapy or depression, click here.